So when we think about health outcomes, most of us would assume that obviously our lifestyle is very important, but also the type of healthcare that we get really does drive good health outcomes. But surprisingly, in the United States and in other countries, 20% of our health outcomes is determined by our clinical care. And I'll say that again, 20% of our health outcomes is determined by our clinical care. 80% is determined by the social determinants of health, such as the determinants that you mentioned, Jeff, our lifestyle, our behaviors, also policies and programs. And I think this is really important to highlight. And what's more important to highlight is these conditions for communities of color, particularly Black and brown communities in the United States, these are not conditions of choice. These are conditions after years and almost centuries of systemic racism and policies and structures and systems put in place to create these social conditions for these particular communities. And as a result of that, we get these very poor health outcomes. Just to give an example, in 1944, we had the GI Bill that was ushered into law, right, giving benefits for veterans, including college tuitions, low-cost home loans, and unemployment insurance. But it was structured in such a way that Black veterans, 1.2 million Black veterans, were excluded from this program. So while there was the emergence of the suburbs and the mortgages and people getting these protected kind of mortgages with low interest and insurance, this was not afforded to Black Americans, which led to redlining. It even went so far as to build walls to separate these communities. And so if you did get an integrated communities with Black and white people living together, the white community would be excluded from mortgages. Therefore, it compounded the issue and further enforced this segregation. And when we think about Jim Crow laws, etc., these are just conditions that were kind of socially engineered for the Black community and other communities of color. Now, we did have the Fair Housing Act in 1968 that put an end to this discrimination theoretically, but practically these things still exist. So that's just one of many examples that explains why we have these poor living conditions that particularly communities of color are living in, and how that can lead to their health outcomes.